Thank you, George. I just want to thank everyone for coming today to kick off the first training in our series of the community table that is made possible by Anthem Medicaid. With Anthem's help, we are able to make this series free for housing case managers and anyone that is helping in the community for our houseless neighbors and any of our neighbors that are experiencing housing insecurity. And through their help, we're also able to provide this training series for over 12 months. The training series will be taking place each Wednesday on the first and third Wednesday of every month at noon. And with their help, we're able to provide and reach out to high caliber trainers from all over, both here locally, like today we have George with us, and also national trainers as well. And we are just so excited and thrilled to be starting this series today. So thank you all so much for being a part of this. And if you can see in the chat, there is a worksheet link. It's a Google Doc. So that will be a link for you all. We will also be sending out an evaluation for today's training as well. And so now I'm going to kick it off to Miss Kim Ashlock, and she will talk to you a little bit about Anthem Medicaid. So thank you all so much.
So good afternoon and welcome. My name is Kim Ashlock. I'm a community relations rep for Anthem Medicaid, and we are so excited to partner with the Coalition for the Homeless to provide this lecture series. So I just wanted to take a couple of minutes to highlight some of the different value-added benefits and programs that we offer our members. So since 2014, Anthem Medicaid has served more than 160,000 members in Kentucky. We've worked with over 20,000 healthcare providers, and we're committed to helping our members stay healthy by finding doctors who fit their needs, listening to their healthcare challenges and goals. And through our member empowerment program, we're taking a holistic approach and looking at needs that the member may have outside of healthcare. Lastly, with our value-added benefits, which help remove some of those barriers to obtaining optimal health, this is our step towards health equity. So in addition to healthcare benefits, Anthem Medicaid members have value-added benefits available to them, which we've kind of broken down into different categories. So we have those targeting maternal and child health, education and employment, promoting healthy lifestyles, wellness, and opioid supports. So for example, mothers who complete 7 prenatal visits, they can receive a portable crib or car seat. If they complete their postnatal visit, they can get 200 mail order diapers delivered to their home. We have gas cards. Whenever members complete an HRA, they can get $200 gas card, or that's in $50 per quarter, or they have access to a bus pass. We have fresh fruits and veggies program where members who have a medical condition or may have a food insecurity, they can receive up to 3 boxes a year of fresh produce. So in addition to those benefits, we offer healthy reward incentives where members can be rewarded with gift cards just for going to the doctor and keep staying on top of their health. Some programs that we offer our members include our member empowerment program, which provides benefits specific to a person's social determinants of health needs. This is a great program that can help our members manage needs outside of their healthcare: food, transportation, housing, clothing, criminal expungements, GED, among others. And this is available to all of our Medicaid members, whereas referrals can be made self-made or by a provider or a community partner. We also recognize that some health conditions need extra care and support. So we have a team of clinical and non-clinical professionals that provide case management for members with chronic conditions. Members have access to Live Health online program, which is a no-cost telehealth program for members. They're able to visit a doctor day or night without leaving their home to diagnose common health problems. And if needed, they can have prescriptions sent to their pharmacy. So like I said, I just wanted to take a couple of minutes, and that was just kind of a quick highlight of the few programs and benefits that we offer. But please feel free to let us know if you want additional information or have questions or comments. But thank you so much for your time, and I'll turn this back over to Danielle. Thank you.
Thank you so much, Ken. Okay, I just want to go over a few of the housekeeping rules for today for our time together. So this training is being recorded. We will send out the recording to anyone who has registered. Please mute yourself, and please use the chat function for any questions or raise your hand. Myself, Melissa, and Erica, 3 members of the coalition, will be monitoring the chat and monitoring hand raising. You will need to have a piece of paper available. And if you are able to, please join the training with your video on, since this is a community table. And we are wanting to try to create a network as much as possible and create a community space. We are also have available closed captioning for those who are in need of it. If you go to the bottom of your screen, there is a place that says CC live transcript, and that is how you will enable the closed captioning for those who are in need. And we will also be at some point breaking off into breakout rooms as well. And so now, welcome everyone to the community table made possible by Anthem Medicaid and the Coalition for the Homeless here in Louisville, Kentucky. And we are now going to hear from George Eklund, our Education and Advocacy Director, who has been with the Coalition for the Homeless for almost 3 years. George, take it away.
Thank you, everybody. I'm so humbled to be able to come and talk to you all today. And when Melissa was telling me how many people had signed up, like, this is a really powerful moment, because we have over 150 people from across the state that have plugged in and said, like, yes, I want to learn about advocacy work. I want to connect with other people across the Commonwealth. I want to learn more, and I want to be part of a community of learners, of advocates, of people that care about housing. So for those of you who don't know me, my name is George Eklund. I work as the Education and Advocacy Director for the Coalition of the Homeless. I've been with the Coalition for about 3 years. I started in 2019. And for those of you who don't know me, like, for me, housing is a human right. Like, everybody needs a safe, affordable place to call home. You know, it's a foundation stone for everybody to build on their success. And it's a place for us to retreat to every day to say, like, you know, I had a terrible day. I'm going to go home and just recharge and collect myself and get ready to go out the next day. This belief really started when I was in 4th grade. So April 1st, 1996, I was invited to a guy in my class, 4th grade class, named Billy Brown. Billy drove me, or my dad drove me to Billy's house, and we drove through the Daniel Boone National Forest. And it's just Appalachia. Like, I grew up in Eastern Kentucky, in a small town in Northeast Kentucky. And we drove along a ridge to Billy's house, and, you know, we finally got there, and I was just confronted with this moment of coming up to a single wide trailer, a couple of broken down cars in the front yard, a washing machine on the porch. It is what a lot of people would probably consider to be poverty porn. Like, it's just what people think of when they think of Eastern Kentucky. And, you know, Billy welcomed us into his home, and I felt the warmth of that multi-generational family living under one roof. I saw a house with pictures of family, with Little League trophies, you know, on old wood paneling, and with shag carpet. Like, it was this completely different space than what I was growing up in. So as we were waiting for other people to come to Billy's birthday party, it quickly became apparent that I was the only person that showed up. April 1st for UK fans of 1996 is an important day, because that is the day that the UK Wildcats beat the Syracuse Orangemen in the national championship. And everybody else chose to stay home to watch the game, whereas I went to Billy's birthday party. All the usual festivities, birthday cake, we blew out the candles, we exchanged gifts. but there's one moment that really like, I always think about it where like I went into Billy's room and I realized that there was not a place for Billy to do his homework. Like he shared his room with one sibling, and it was probably, a quarter of what the room that I had at home. And that has always like thought of me, that's always like been part of who I am and where I go to, because that's the kind of work that we're working on. We look at Kentucky as a whole right now, we need 80,000 units of affordable housing for those that are in the least. Each year, there are 40,000 evictions that take place in Kentucky. And that's 40,000 families that are in some sort of dire circumstance. Thousands of JCPS students are homeless each year through displacement. And usually they're doubling up, they're figuring it out, but it's not in any way, shape, or form thriving. So, for me, I always like to bring in like that personal aspect of why I do this work. I'm working for a better Kentucky. I invite you all to be part of this conversation so that you can too be part of this, to working towards solutions. And that's why I'm so excited to talk about advocacy with you all. Advocacy for me is about community. It's about building a movement, and that's why I'm here. So in the chat, or if people want to speak up, we're just going to do a couple popcorn questions, and then we're going to learn a tool that I use constantly, and I train people on all the time when they go and do any kind of advocacy work. So in the chat, I just want to get some people's initial thoughts on like, what is advocacy? What does it look like to do advocacy work? How have you advocated in the past? And so let's get a couple responses from there, and then see what kind of thoughts people have. Or if you're able to unmute, feel free to, yeah, thank you, Natalie. So fighting for people who do not have a voice, being a spokesperson for a client, yeah. Standing up for others for what is right, speaking for those who don't know how. Helping with community resources, thank you, Bev, yeah. Advocating for policy change, yeah, this is all part of advocacy work. And it's when advocacy work, we have different audiences. Sometimes they are people with lots of power through elected offices. Sometimes it is the administrator at the Social Security office or the driver's license office of just trying to get that. Yeah, this is great, thank you. So as service providers, why should we be advocates? Like, what is our role in this work? And again, like popcorn in the chat, or feel free to speak up if you would like to. So Kara, to break through barriers, yeah. To assist and remove barriers. I like that, Stephanie. To ensure, yeah, thank you, Mark, to ensure housing stability for all. Identify the needs and developing client-centered goals. I like that. I like the centered goals of like what that, and Danielle and I have talked about progressive engagement with like progressive case management, meeting people where they're at and not doing just a checklist. A fair process and access, yeah. For me, I really believe that we as providers, we as advocates, we as like the people that are, we're the closest, we are proximate to the problems. We hear the ins and outs of every person that is experiencing housing instability or homelessness. We know where the cracks are that people are falling through. And if we don't speak, there's a vacuum. Like every day, if I go to Frankfurt every day, I'm talking to people that have no idea how hard people work to get into housing. And they have no idea how hard it is to get housing. They all own their homes and they just take it for granted. Whereas a lot of people that are very low income and renting, they know they know that it's a lot harder out there. So, I mean, it's our responsibility to fill that vacuum because we're proximate to the problems and we know them. I like to do advocacy work through stories. I think it's effective. I think it works. And I had a meeting with a representative, Empower the Broken. Thank you, Ashley. I like that. I had a meeting with a representative and I knew all my facts. I was pretty green. I knew all my facts. I knew all my stats. I knew how to talk about it. And I was just going to tell them that it was the right thing to do. And I had another person with me who had that personal story of what they were going through. And the representative flat out told me, like, yeah, you're smart, you know your stuff, but you're boring. Like, I want to know more from Mike. I want to know more about what his experiences and what his thoughts are and what he wants. And I think that speaks a lot. Like, stories motivate us, they move us, they inspire, they contextualize, they humanize problems versus, like, you know, if we can talk about the 17,000 people being evicted each year in Jefferson County, you know, that's one thing. But if we can talk about like the personal experience of like what it's like coming home and finding Christmas laying out on the front lawn, that's a whole different kind of experience. So as case managers and housing advocates, we're confronted with a lot of problems every day, and these problems all require action. You know, we tap into our heads and our hearts when we're trying to figure out what to do. Our head is a good way of thinking about problems and moving towards action. And it's usually using that language of strategy of like, if I do X and Y, then we can get this. But our heart is really good at feeling our way to action, of like kind of compelling us to make that phone call, make that ask of another agency. And it's really why we should be doing something. So stories, for me, I really believe it helps bridge the gap between these two forces. So it kind of combines that strategy part of the brain and it combines that heart part of the brain. So when trying to solve problems, who here thinks, and you can do a thumbs up in your screen or in the chat, when trying to solve problems, who here thinks with their heads first? Like, who's our head person? Who is moved? Who is convinced by numbers, basically, is what this is. So if you are that person, feel free to raise your hand or just give a thumbs up in the chat. And then who really here relies on their heart? And I am like a heart first kind of person and I know many other people in this industry, in this sector are that, yeah. So to take meaningful action, we really need to bring both of these together, and especially for policymakers. Like this is we need to kind of bridge that gap. If we remain in our feelings all the time, we don't really have a strategy, and people are going to kind of feel demotivated and like, well, I want to help everybody, but I can't. On the other hand, we know that people can analyze problems, and I think certain sectors of government really like to analyze problems until they're blue in the face. And like, we can do so many blue ribbon commissions and we can do so many studies, but we never really move to action on some of these things. So through storytelling and public narrative, we can get people to feel something by both sharing why we care, but also how we can address the problems at hand. So we can move people to action with us, really. I'm going to pause here. Are there any questions or thoughts? I'm going to give you 30 seconds to drop something in the chat before I move on.
I just want to highlight what Tara said in the chat. Heart motivates me, but head keeps it real.
Yeah, I like that a lot. That's really good. Yeah, Tara, I'm gonna borrow that. If you don't want me to, like, just DM me. So there's this guy who's kind of a legend in like the organizing world named Marshall Gantz. If you are really into organizing stuff, I would just Google search Marshall Gantz, and he has a whole bunch of YouTube videos from his classes that he teaches at Harvard. He was an organizer. So he went down to Mississippi during Freedom Summer. He left out of Oxford, Ohio. He worked out in California organizing farm labor workers with Dolores Huerta and Cesar Chavez. he developed this idea called public narrative. And it's a framework to really bridge that gap. And it combines three pieces, and it's really three separate stories that we use. And they are the stories of self, the stories of us, and the stories of now. And we're going to kind of go through this framework. And this is a tool that, like I said earlier, like it is a tool that I use anytime I send people to go talk to Metro Council. It's a tool that I use constantly. And I hope that you all can see some value in it. So the first piece, the story of self, is all about understanding your own choices, your values, and your motivations. The question here is why are we working in homeless advocacy and housing insecurity? Like, why are we doing housing work? It's not easy, it's hard, and it's really frustrating sometimes. Your story of self communicates your values and why you've made that choice at this point in time. And it's really, why are you leading in our community? So think to yourself right now and put in the chat, why do you do this work? And you don't have to put it in the chat, but reflect, like, why do you show up every day to help people? The story of self may be professional, but it also may be personal. It can be big, it can be small, it can be just an anecdote of like, I do this because of X, and that's why. I usually preface this like, your stories are yours. Don't feel like you have to share them. Don't feel like you have to share your deepest, darkest trauma. Like, you share what you want to in this situation. But it's really kind of why we bring ourselves into this work, is what the story of self is. The second part, passion, human respect. My heart hurts for the underdog. Thank you for people putting stuff in the chat. The story of us is more about like the broader picture. So this is where we ask, what is the shared experience of the greater community? In this case, our community of community and homeless housing advocates. The story of us communicates the values and experience that a community, organization, or campaign or movement share, and what capacity and resources that the community has to accomplish that. This is always where I bring in data pieces, because it kind of tells a bigger picture of like, what is the story, what is going on, like on the grander scheme. Like, I know what's going on at the door of a certain house, but how is that connected to the bigger experience that we're experiencing here locally? The third part, and this is probably the most important piece, is the story of now. So this part of the story creates a sense of urgency, and it calls people to do an action. And it's really acting based on the values that you're bringing in. So the story of self, and then you're being called to act because you are, because of that story of us as a collective community. So you're getting both that head and that heart lenses that are getting applied to that ask. So the ask is important. It could be a big ask. It could be vote for this bill, support this. It could be small. It could be change our policies about how we interact with somebody that is sleeping on the streets, or it could be change our policies about how we get IDs to people that are homeless. Like, it can be grand, it can be small, it could be just, will you join this? Will you sign this petition? Will you send a letter or an email to our elected officials? It doesn't have to be a grand ask. It can be a small thing of even just donating a couple dollars or volunteering at your local agency. I'm going to pause again. If anybody has any questions, feel free to speak up or drop it in the chat. Okay. So I want to just think about also like how to tell a story. when you think about your favorite films, your novels, your TV shows, like what makes them so memorable and compelling? And you can drop that in the chat if you want to highlight anything that really makes a story good and land well with you. Anytime an underdog comes out top, overcoming challenges and or adversity. Thank you, Mark. Thank you, I think, Kathy. So good stories make us see it. They make us hear it. They make us feel it. So you do it by showing and not telling. You include vivid imagery, you include details, you connect to strong emotions. You kind of put yourself in those. And my father's an English professor, and he would always edit my stuff, and he would always ask these questions of like, what did it smell like? What did it feel like? How did it look? Just bring your audience into that space that you're in your mind. And remember, we have a character, we have a plot, and we have kind of an overall like story arc of like, this is what happened, this is the pivotal moral moment, and then this is the descending action on it all. So we're going to hear an example. So this is done by my really good friend Savannah, and she was speaking at the Metro Council meeting on April 14th of this year. So this is about 3 minutes, and then we'll come back and debrief it.
Good evening. My name is Savannah Winston, and I am a part of the eviction prevention team with the Coalition for the Homeless. My job is to inform those at risk of being evicted about programs available in Louisville. I witnessed my first eviction when I was less than 10 years old. In a neighborhood I grew up in, the entire community was raving about a family whose whole livelihood had been removed from their home and placed in their yard. Items that were once treasures to one family were being picked through and taken in as treasures for another. I had no idea what was going on as an 8-year-old, but over a decade later, things came full circle when I had to knock on a door on that exact same street. Returning to the site of this childhood memory is something I will always remember. With a heavy heart, I wondered if that family all those years ago would have been able to stay in their home if someone like me had knocked on their door with options. For the past 11 months, I, with my colleagues Ray, Charlie, and Caitlin, have knocked on almost 8,000 doors. We have heard stories of Kentuckians struggling to pay rent after their hours were cut at work. We have witnessed deplorable conditions with leaking roofs, faulty electric, and sagging foundations. And we have stood on porches with people who were traumatized by landlords willing to turn off utilities or remove locks on the door to force them to move. Evictions are not a feature of the pandemic. You all have heard the statistics countless times, so for the sake of time, I will not be repeating them today, but we need to be asking ourselves why our rate of evictions filed were 2 times the national average even prior to 2020. Renting is an exercise of navigating a system rife with abuse, with many pitfalls, and Kentuckians are a crisis away from homelessness. Simply put, low-income tenants do not have any power. Because of the lack of affordable housing in the state and lack of protections, tenants are forced into bad and unsustainable renting situations with landlords who provide substandard conditions at extremely high rents. I hope and work for a Kentucky where every person can work, worship, raise a family, and exist in vibrant communities regardless of if they rent or own. To get to this future, we must work to address deep-rooted systemic issues in our rental market. While my team and I are doing our part in ensuring your constituents have a place to stay, what we do is only a band-aid to the bigger root problem. I ask that Metro Council continue to focus on housing in the upcoming budget discussions. We need to continue the hard work from past years to meet this critical need. Please renew and fund the Right to Counsel Ordinance, fund the creation of affordable housing through the trust fund, and work to support low-income renters with legislation that will correct the unjust power imbalances in the rental market. Finally, I would like to close by echoing and emphasizing the need to address the failures of Louisville Metro Corrections to keep 8 of its occupants safe and alive. Not only is it imperative that those responsible are held accountable, but we must also address old bench warrants that follow those facing homelessness. We need to take a stand and do better. Thank you.
All right. Get back on my right screen here. All right, so thinking about Savannah's story there, and you can drop it in the chat, where do you hear the story of self in the story of us and the story of now? We can focus on the story of self first.
You can also unmute if you want to do that
Yeah.
instead of using the chat.
Yeah, so her first experience with eviction. Thank you, Kayla. And where do we hear the story of us?
When she talks about what her and her coworkers are doing to try to overcome this and to assist individuals who have similar experiences as her.
Yeah. Thank you. And then what, were there any common themes and values that ran through the story that kind of really stood out to anybody? For me, one thing that she's always kind of like hearkening on is like a kind of more of a like a justice lens to this work, not just I think she sees it more as like a systemic failure in a lot of ways, versus like a one-off, like, well, this is just bad luck. It's more, we're setting people up for failure in a lot of situations. And what was the ask? Yeah, the budget. Thank you, Angel. Yeah, just funding the Affordable Housing Trust Fund and caring about home renters in a different way. With this, it was like the supporting and funding the trust fund. That's a very like concrete thing that Metro Council could do, versus a more nebulous task of like supporting home renters or focusing on home renters that are struggling. So, all right. So what we are going to do now, and generally I've done this training in person, so this is going to be a little different. For in that link that has been shared out multiple times and the attachment that I put in the chat, I want you to think about your own. For 5 minutes, I'm going to play a song, and once that song is done, we're going to break out into breakout groups of 5, and you all can kind of just workshop these things. Am I expecting like done well, like finished products? No, this is just more of like getting our wheels turning to think about, one, what is my story of self, us, and now? It could be your own problem going on right now. It could be something that you just make up. But I just want us to kind of think about it and do a little exercise here. So I'm going to play the song, and then we are gonna come back and go to breakout rooms.
They're filling out the first page of the worksheet, right, George? And will you drop that PDF link again as well?
Yes, I will put it back in the chat, and we are doing the first page of the worksheet. That is correct. Thank you, Melissa. All right, everybody. I think we have most people back at this point. Is there anybody who's brave and would like to volunteer to unmute and just share a rough outline of kind of their story of self, us, and now?
I will. I was in group 10. We each shared, our own personal experiences that have drove us to do the work we're doing. We talked about it's the passion that we have, which is what, while we're doing the work we do, we talked about struggles we see in our own areas. We're all in different areas of Kentucky. We're working with adults, some are working with children, and just ways that we can improve housing. Me and another member talked about the private sector. There's more private renting than there is for subsidized. How, it's not keeping these people out. It's really helping with the resources they have that could bridge this gap of not having the housing that we need.
Yeah, thank you, Kim. And I like that of personal experiences, and then talking collectively, like what is that story of us of, what is our shared experience going on? So yeah, I think that there's a lot of good things there. Is there anybody else who wants to give a quick synopsis of how their conversation went?
I will speak. Just for me, as far as when did I start to care as far as myself, I said that Michael Brown was probably the big catalyst that made me really, really start paying attention. I was very upset during that time. And Breonna Taylor, being that it happened here, that's when I was able to become active because it was close to home and in my community. So I was able to step out. The values and things that I share is just far as wanting better for my people in the community, just wanting things to be done right and helping people, just having a heart for things that are right, and just people that may be less fortunate, and not even necessarily just less fortunate, but just maybe struggling in that moment, or just trying to get over a hurdle or get through a barrier that they may be facing. The changes that I want to see in the world would be changes as far as us, how we help people. I think one of my biggest frustrations is the assistance that a lot of people, and I'm sure we all see it, the assistance that people need in community is often very hard to come by. And there's a lot of barriers in order to get it, but I just dislike it because it's what people need to live. It's the necessities of life, whether it's food, whether it's transportation, whether it's housing, things like that. If they're trying to live, and anything that people need as far as trying to better yourself, it always seems like in America, it's so hard to get it, but anything to be destructive or violent seems so easy. And that's something that I would like to see change as far as being able to help our community. It being a lot easier to be able to help them, especially because a lot of times, as we all know, it's spur of the moment type of thing. Is at the last minute and they need that help then. And sometimes it can be a matter of life or death, or them choosing to be helped, or you don't know where they are in their mind space at that moment. So I would like to see it become easier to be able to help the community.
Yeah, thank you so much for sharing, Mel. In the chat, how do you see yourself being able to deploy this tool in this framework of public narrative? So for me, I know we're running short on time. So for me, so to engage the community in the work, listen more, sharing with community groups that I'm a part of, coworkers, company, community partners. And this is why I like this. I mean, this can be used in so many other avenues. Like it could be used on one-on-one meetings of you have a prospective volunteer or prospective board member. You can use it in op-eds and in letters in the same story arc of this is why I do this. This is the story of us. And then this is the ask of what I want the public to do. You can use it in public events, speaking events. You can do it with agencies like state agencies that you're trying to get a more systemic change to. Elected officials, both state and local. This is just really a tool that you can use to try and sway people into your corner. I'm a big believer in the streams theory of public policy, where you need a problem, you need a solution, and you need a political will to get things done. So And I am going to just highlight a couple things. These are ways for you to, first off, I appreciate everybody engaging and being part of this conversation. There are 3 ways that you can remain part of this conversation. So one, you can join our advocacy list. And I believe Erica is going to dump a bunch of things in the chat here. You can attend our next community table training, which is July 20th. And you can join our advocacy working group. And all of those asks have details in the chat of how to do that, Erica is posting right now. And with that, I am going to turn it back over to Danielle, who's going to close us out.
I want to thank you all again for joining us for our very first presentation in our community table learning series. And I also want to thank you again to our sponsor who made this wonderful series possible, Anthem Medicaid. As George mentioned, our next presentation will be July 20th at noon. It is community and systems level advocacy. You will learn to use your political power as well as practice self-care and advocacy work. And it will be presented by Celine Mutu Ye Maria. She's an activist, organizer, and housing justice advocate. And Celine is going to use the ecosystem model to demonstrate how different levels of advocacy interact to create community change. Erica, if you can put a link to register in the chat, and there is also a link to register at our website. And then whenever we send out our email with the recording and any materials, we can also add in a link to register for the next training as well. And thank you all again for spending your afternoon with us. And we look forward to seeing you all again for the rest of the series.
Did you highlight the evaluation survey, Danielle?
Oh, yes. Thank you, Melissa. We also will be sending out an evaluation survey. Erica has put it in the chat for you all, and we will also be sending that out in the email. In the survey link, there is also a place for you to mark if you're interested in receiving a little surprise or package from Anthem Medicaid as well. So you can just enter your information and they will mail you something out, a little swag bag, which is just a nice little thank you for joining us today. And also the survey link helps us know what you liked, what you didn't like, and how we can improve and continue to make the series everything that the community is in need of. So please, 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 please fill that out. So thank you all. Go ahead, Melissa, do you have anything to add? I apologize.
It's very short and easy. It should just take you a couple minutes. So please do fill that out for us. And thank you all for being here. We're super excited. Thank you for being in our inaugural The Community Table session.
Yes. Yeah. Thank you all. And we will see you all next time. Bye.